Hello, everyone, and welcome. We are going to get started in just a moment. This is the NAC webinar on Health Center Program Lookalikes, Building Your Grant Management Infrastructure. My name is Olivia Bojano-Peterson, and I am a program specialist here in the Training and Technical Assistance Division at the National Association of Community Health Centers. I'm very pleased to bring you this webinar along with my colleague, Ted Henson, who is the Director of Health Center Growth and Development, and he will be getting us started in just a moment and introducing our speakers today. Before we get started, I have just a few housekeeping items to go over with you all. Please note that this event is being recorded, along with the chat and the Q&A. The recording, slides, and additional materials will all be emailed out to registrants within the next 2 weeks. For a copy of today's slides, please see the email reminder that was sent out this morning. You will notice that attendees' video and microphones are disabled. Please feel free to submit comments and engage with your peers in the chat panel, which will be on the right-hand bottom of your screen. We invite you to go ahead and introduce yourself in the chat and let us know where you're joining us from today. If you have questions that come up, and we will have several opportunities for Q&A throughout the webinar, please enter those questions into the Q&A box so that we can direct them to our panelists. Additionally, we will be using polling in today's event, which will also appear in the right-hand side of your screen. The duration of this webinar is approximately 90 minutes, including some time for Q&A. And then finally, we will be emailing you a survey after this event to let us know how we did. We really value your feedback and encourage you to complete the survey. And now, without any further delay, we will get started, and I will turn things over to Ted Henson. Thank you.
Great, thanks, Olivia, and welcome everyone. On behalf of NAC, I want to welcome you today and thank you all for the work that you do every day to provide high quality healthcare to patients and communities you serve, especially during a global pandemic. Next slide, please. So this is NAC's first webinar specifically for lookalikes. All health centers, all FQHCs are welcome today, but we wanted to be intentional about creating a place for staff from lookalikes to come to get information specific to building your grants management infrastructure and program. So for today's webinar, we're excited to welcome some experts in the field. First, we'll hear from Catherine Gilpin, CPA from BKD, a well-respected national accounting firm with extensive experience serving federally qualified health centers. Catherine will be speaking on building your grants management infrastructure and drawing down ECT funding, and will provide an overview of the 18 management control areas the Department of Financial Integrity, DFI, uses to review health center policies related to grants management. Next, it's been my privilege to work with a really wonderful lookalike health center in Pennsylvania, the Wright Center, who has done not just a great job with their grants management policies and procedures and process, but really with their overall strategic direction with regards to how they're implementing their ECT funds and other funds, really with an eye towards financial sustainability. So we're going to hear from them, and then afterwards, we're going to open it up to question and answers for about the last 10 minutes of today's webinar. It is a 90-minute webinar, so please do enter your questions in the Q&A box, as Olivia mentioned. At any time during a question, we'll try to get to it at the end. Next slide, please. So this is some late breaking news, and I apologize, I'm going to take a minute just to talk about this because it's a pretty big deal. But earlier today, as you might have heard of, the Biden administration announced a historic $10 billion investment to expand access in COVID-19 vaccines and build vaccine confidence in hardest hit and highest risk communities. And this has meant a huge investment in community health centers. We will share a link to the White House press release and then also to a HRSA link of the awardees. But currently, as of this morning, there were over $6 billion, that's with a B, $6 billion to support the 1,376 330 funded federally qualified health centers. I won't read through every bullet point, but as you can see, it doesn't just go to expand COVID-19 vaccinations, but also to deliver preventive primary care to people at higher risk for COVID-19. So that's the communities that lookalikes and 330 funded FQH serves, that health centers serve. There is also money to strengthen vaccine confidence, invest in community health workers. And I will note that on the Tuesday calls with Jim McCray, the BIFIT calls, Jim McCray has referenced that lookalikes will likely be included in future funding. So we know there's some money still left to be allocated, so our fingers are crossed. I think that just underscores the importance of today's webinar on grants management, if there will be, even if it's one-time funding, these injections of cash to help support the work you do. So again, thank you for making the time to be here today. Next slide, please. Not to go over it again, but in the marketing for this, we wanted to make sure that we were clear about what the intent of today's webinar, which is to highlight challenges and barriers for health centers related to building a grants management program and using funds. We're going to provide an example, as I mentioned, of one health center, and that's a federally qualified lookalike health center's approach to building a successful grants management program. And also, we really just want to underscore the importance of drawing down versus the supplemental funds for lookalikes. Next slide, please. This is more of a reference side. I don't want to spend too much time on it because I want to get to our other speakers, but this is a data point you can come back to that really just shows what a large footprint lookalikes that you all have and how much we appreciate the work that you do. Here's the UDS data that was released for 2019. But earlier this year and at the end of last year, we got some updated data from HRSA, so that number's actually kind of gone up since it was last reported in UDS. There are currently about 88 lookalikes. And last year, as you know, you received, many of you, I think about 78, received $17 million in that first time ECT supplemental funds, and that's what the Wright Center will be speaking about today. So again, we thank you for what you do. Next slide. My colleague Jervine Williams, the Director of Health Center Financial Trainings at NAC, and I just wanted to flag that she's working with BKD on doing a review of 5 health centers grants management programs. She is looking for a lookalike specifically, and I apologize, there's a typo on here, but she's looking for a lookalike specifically that would be interested in being a part of this. This means that you'd be working with BKD to do a review of your grants management policies and procedures. So if you're interested in this, this would be something that you'd be donating your time to, but I think there could be great value for your health center. I have Jervine's contact information on here, so if you're interested, reach out to Jervine specifically, and she's also on today's call. Next slide, please. And then last, I just want to say that NAC is also working with about 20 lookalikes currently in our first ever Lookalike Learning Collaborative. It's underway. Some of you have reached out, and we had unfortunately already filled up the Learning Collaborative, so I included a link here, and I'll put another link in chat for how you can sign up to get information about future learning collaboratives for lookalikes. We hope to launch this again in our next fiscal year, which begins in July of this year. So make sure if you're interested in this opportunity to engage with other lookalikes specifically and develop projects and work with them on different projects, feel free to sign up that link. Next slide. Oh, and here's just a list of all the health centers participating in our Lookalike Learning Collaborative. So we have great national representation. Next slide. So I'll keep moving it forward because I've already mentioned who we have speaking today. And without further ado, I'm going to turn things over to Catherine Gilpin from BKD. Take it away, Catherine.
All right, thank you, Ted. Next slide, please. All right, so as Ted mentioned, I am a CPA and I work for BKD. We actually work with about 25% of the funded FQHCs across the country. So we do a significant amount of work with community health centers receiving grant funding. Next slide. All right, so one of the things Ted mentioned and that we're going to talk about today is the financial management reviews that HRSA actually performs for community health centers, but then also potentially lookalikes, right? So I want to set the stage for this discussion. I want to help you to understand why the financial management reviews are important, because these financial management reviews are in essence desk audits that HRSA can perform related to the fiscal structure, your grants management program. So we're going to talk through during the next 45 minutes. We're going to go through 18 very specific key control areas that the Department of Financial Integrity uses to monitor health center policies. I want to talk this over, and we're focusing on policy and procedure language, mainly related to the fact that your policies and procedures form a very important foundation related to your grants management program. When you look at grant funding, the very first thing that HRSA is going to do during any site visit, or even your financial statement auditors, is they're going to look at your policies and procedures. And they are going to, HRSA focuses on policies and procedures, right? Because you should understand the rules related to the grant funding that you've received. But one of the biggest, another reason that I think HRSA focuses on policies and procedures and making sure that they're appropriate is that health centers, and that's inclusive of lookalikes, we are serving in we're providing medical services to medically underserved populations and medically underserved areas. these organizations, have a tremendous amount of turnover, whether it's your frontline staff or potentially administrative staff. It's very difficult for a community health center to recruit a CFO or bring someone into their health center in a financial capacity that has experience administering 330 grant funding. A lot of the work that I do, we work with new CFOs. We typically tell our new CFOs, even if you're experienced, even if you come into a health center and you've got significant other, healthcare industry experience, it's probably going to take you a year to 2 years to understand all of, the things that you need to know to appropriately manage a grants management program in a community health center. So, at the end of our discussion today, we want to, do a couple of things, right? We want to make sure that you're more comfortable with the grants management program that you have in place. We want to make sure that, one of the things that we know about the ECT funding that the lookalikes have received and all of the support provided to providers across the country, whether it was provider relief funds, whether it's ECT funding, whether it's, part of the $7 billion that Ted just mentioned that was released, additional information was released today. What do we want to make sure? You have a good grants management foundation so that when any regulatory agency comes in and audits your use of these grant funds, that you don't, put yourself at risk of having to pay them back. I always, as part of any discussion, when I start talking about grants management, one of the things, I've been using an example recently of the most recent audit of health center grant funds that was released by HHS OIG auditors in November of 2020. They actually did an audit of health center AIMS grant funds that were provided to health centers in 2017. They released the results of this report in November of 2020 and concluded that about 15% of the grant funds provided to community health centers actually had been spent for purposes that weren't allowable, either for unallowable expenses, wrong time frame, problems with time and effort reporting, etc. 15% was their recommended payback, right? So think that through and think about your ECT funding that you received. I don't want you to have to pay 15% of that back. I did a little bit of math the other day related to the, $7 billion that was appropriated that Ted just talked about with the American Rescue Plan. Like if you think about if that's $7 billion, and I know, it's getting distributed and we don't know all the details of how it's getting distributed yet. Like if you look at that $7 billion and you divide it by the number of health centers and potentially lookalikes, and you look at a 15% payback, I think we did the math the other day at BKD, and that was like $850,000 an awardee, right? Like that's why we're talking through financial management review requirements today, because this is the language HRSA feels is fundamental to your grants management program. Next slide, please. All right. So we've already kind of talked about this. So Department of Financial Integrity is performing reviews. They're using this financial management review document that has the different control areas. For health centers, if you were a health center that received under $750,000 of funding, they did these desk audits of policies. When the ECT funding was provided to lookalike organizations, HRSA did an FAQ webinar on early July, right? July the 9th, I think. Or it was after July the 9th because they were awarded July the 9th. One of the things they actually said in that presentation towards the end is, hey, by the way, we can audit your grant funds, right? We can do desk audits of your policies, and we can do audits of the expenses you've allocated to grants. We can do all kinds of audits, right? Because we've awarded you these grant funds. All of the control areas that I'm about to talk through are how HRSA performs those audits. So they go through this document and they actually hire, they have a firm that they work with. I can't remember the name of the firm, but they actually have a firm that they work with, and you send in your policies, and this firm will actually take your policies and they compare that to the required language. And that's how they actually do this desk audit of your policies. And so we're going to talk through the language that should be in your policies, and then we're going to talk about why it's important, because I want to help you to understand the fundamentals before we move into and transition to the discussion with the Right Center, where we help you to understand how they've successfully implemented and managed their own grant management program. Next slide, please. All right, so one of the things that I want to mention is there's quotation marks, there's some quotations on the next couple of slides. Whenever you see a quotation, this is language right out of the HRSA review document, and this is the language that they feel is important to your policy. I typically focus on the word must, right, as we're moving through the slides, and it says a grantee must. This means you pretty much need to take the language that I have put into quotation marks on the next couple of slides, or we actually have about 40 slides. We've provided all of the language word for word from the HRSA review document into these slides, and I would highly suggest reviewing them in detail and comparing them to your own policies and taking the language out of these slides and putting it into your policies and tailoring it to your organization. So HRSA in this document has the 18 key control areas, and they developed these 18 control areas by reviewing, the results of HRSA site visits, by looking at audits that were submitted through the Federal Audit Clearinghouse, by looking at other, audits from HHS OIG auditors, and they've put together this policy document that they think is important. Next slide. All right, so we're actually going to go to our first polling question. And that polling question is, do you feel that your health center has appropriate grants management policies in place? So available options are absolutely, not at all, of course, I used example from NAC's NAUTILPod, or I'm unsure. All right, so NAC has a NAUTILPod. I'm not sure if you're aware. One of the things I want to mention is I know that NAC is, through the NAUTILPod, they, it's a place for community health centers to ask other community health centers information and potentially share resources. I know that for those that are in the learning collaborative that Ted mentioned, they already have access to the NAUTILPod. If you don't have access to the NAUTILPod, I understand that NAC is potentially putting out an information package that will be distributed to all of the attendees of today's webinar that should go out in about 2 weeks. And so you would have that information if it should be getting emailed to you. And Ted, did you want to say something?
No, that's exactly right. And just thank you, Catherine. We're going to have a list of, I think, 17 different policies and procedure templates that BKD has provided. So everyone attending today or registered for today will get access to that within 2 weeks.
Yep, absolutely. And most of these we took from the Uniform Grants Guidance or the HRSA, financial management review document, but we feel that there are policies that you could put in place and, read through and implement immediately or at your health center to support grant compliance. So when I look at the results of the polling, we actually had probably about 15% said absolutely, and then there were varied responses below that. And so a majority of the responses are, not at all or unsure. And so, I do truly think those policies and procedures that we've provided through NAC could be helpful to many of you attending the webinar today. Next slide. All right, so let's talk about the first key control area. So what does it say? Recipients must maintain written policies and procedures to minimize the time elapsing between the transfer of funds from the payment management system and the disbursement of those funds by the recipients. So I have some bullet points here. What's the industry standard? When you see this language, the industry standard is actually 3 days. And what that means is that you shouldn't, if you have a compliant cash management program, when you go into the payment management system to draw down ECT funds because you've spent them, it should be within 3 days of when you disperse or you write a check, all right? when you're looking at cash management, you want to make sure that you've written the check, or you're drawing down the funds as close to when you write the check as administratively feasible. All grant funds have to be drawn down into FDIC insured accounts, and you should actually have that in a policy as well. And potentially, if you earn interest income in excess of a certain amount, you do have to return that to the federal government. I don't think many of us are in that position, but it's also potentially something that you could address in a policy. Next slide. All right, so here's some language, and note it's in quotation marks. So, this is the language that we took right out of Financial Management Review document. So the written policies and procedures must reference the process for drawdowns from PMS under HHS awards. They must be limited to the minimum amounts needed to cover allowable projects. What does that mean? When you're administering grant funds, you're not supposed to draw down the grant funds in advance. You would be surprised how many health centers that I talk to, and I say, all right, let's look at your grant drawdowns, and we begin to look at them. And I said, are you drawing down before you spend grant funds? And they say no. And I say, all right, let's look at this draw. And I see a draw for $50,000. And I said, well, how'd you spend that? What'd you spend it on? And they say, well, we're going to buy this. Well, that's something that's happening in the future, right? If you haven't written a check, you shouldn't actually be drawing down the grant funds. So keep that in your mind. That's a #1 grants management principle. You write the check for an expense before you draw down the grant funds. All right. So drawdowns must be timed in accordance with the actual immediate cash requirements of carrying out the project, and they can't be made to cover future expenditures. So when you receive these awards, they were for the time frame July 1, 2020 to June 30th, 2021, and you were allowed to backdate the expenses back to January 20th of 2020, right? So that's your period of availability related to these grant funds. For the lookalikes that hadn't received federal funding previously or prior to this ECT funding, we get a lot of questions about the required submissions in the payment management system. One of the things to note is that when you're reporting in the payment management system, the drawdowns are pre-populated. And if you recall, you're reporting disbursements in another screen, right? If you think about what I told you, the disbursements in plain language is the number of checks that you've written. Your disbursements should always be greater than your drawdowns in the payment management system. Otherwise, you're telling HRSA that I drew down grant funds before I actually had an expenditure. So be careful how you're reporting in the payment management system. This last bullet point is actually talking about supplemental funding for health centers, but the same applies with the ECT grant funding. If I'm looking at ECT grant funding that's getting used by the lookalikes, one of the most obvious things that would point me to the fact that maybe you've not administered this grant the way you should is if I look at your total award and I divide it by 12 and you're drawing down the same amount every single month. You might want to and be able to do that with a 330 grant, but the way that I've helped you to understand, you should have actual expenses and you should be drawing down based on actual expenses. I would be shocked if your actual expenses were the same amount every single month, and that would almost immediately begin, I would just start asking you questions and I'd try to figure out what you're doing because I would think you have a problem. Next slide. All right, so period of availability of funds. We've already kind of talked about this. You can use these funds for expenses backdating to January 2020 through June 30, 2021. One of the important things to remember as you approach the end of your grant period, which is June 30, 2020, is that on this second bullet point, an entity must liquidate all obligations incurred under the award not later than 90 days after the end of the funding period. So if you have an expense on June the 30th, you have to write a check within 90 days and you have to draw those grant funds down in the payment management system within 90 days, or you actually are going to lose access to those funds. We get a lot of questions about, do I need to have a separate bank account if I'm new to federal grant funding? Absolutely, you don't, because you shouldn't ever have grant funds in your bank account because you're always writing a check within 3 days of drawing the grant funds down, right? You would never draw the grant funds down more than 3 days before you write the check. So you don't have grant funds in your bank account at any point in time. And it's you don't have to have 2 separate bank accounts. Next slide. All right, so we're going to go on to annual audits. So here's what you should have: an annual audit policy, and here's the language that should be in that policy. It is the policy and procedure of my health center that I will prepare a schedule of expended federal awards, and subsequently I will determine, because I am the organization receiving grant funds and it's my responsibility, if an audit is required to be performed in accordance with the Single Audit Act. You have to get a special audit from your financial accounting firm if you get more than $750,000 of grant funds. Your policy and procedures will, you have to say, it's my policy to select and engage an audit firm. It is my policy that I will report on the audit. I'll submit my audit report to the Federal Audit Clearinghouse within the earlier of 90 days after the receipt, or 9 months after the fiscal year end. So the receipt of the audit, or 9 months after the fiscal year end. So one of the questions you might be thinking through right now is, well, my award wasn't $750,000. Do I need to have a policy about audits? Absolutely. Once you receive a federal audit, you should have all of these policies, because HRSA wants to make sure that you know that if you did get more than $750,000, you know that there's a requirement related to the annual audit. Next slide, please. All right, these are just some of the most common financial statement audit findings, whether it's from a Uniform Grants Guidance or financial statement perspective. We're going to talk through segregations of duty. You'll notice that interspersed, throughout all of the policy language that's required by HRSA, they talk about segregation of duties. We're going to talk about sliding fee testing exceptions. Well, that's just common. And then look at this number 5, cash management and cost principles. So that's just informational. Next slide. All right, the accounting system. When I think about an accounting system that should be in place, one of the most important things that I want you to remember, this was reiterated in the HRSA lookalike presentation that was done in July related to these grant funds. You are required to track expenditures for grants in your general ledger. So keep that in mind, because as you have expenses, you should set up your accounting system to track your revenue and expenses in the GL. One of the basic controls that you have in place, and if you ever receive an audit of these ECT grant funds, HRSA is going to ask for your general ledger, and they're going to say, all right, you have $10,000, you drew down $10,000, show me how you tracked $10,000 in your general ledger, okay? And so different systems do this differently. I mean, QuickBooks uses financial statement classes, maybe Intact, or maybe you're using Blackbaud. Maybe it's a segment of the chart of accounts or some other, classification, but you should do it in your general ledger. HRSA, and the reason the Uniform Grants Guidance says that this is a requirement, is the biggest risk with all grant funds is that you would potentially allocate an expense to more than one federal funding stream. There are so many controls in place with general ledger systems, right? It's a computer program, they've been tested. It's very hard to charge the same expense in your general ledger twice, but it's really easy to charge the same expense to 2 grants in an Excel spreadsheet. The controls in Excel just aren't the same as the controls in the general ledger. So make sure you're tracking those grant funds appropriately. Next slide. All right, bank statements. What do they think is important? Your policies and procedures will address the following. So it's our policy to prohibit the individual reconciling the bank from opening them. Why do they do that? They're trying to support appropriate segregations of duties. They want to make sure that bank statements are opened and reviewed by a recipient official that's not authorized to sign checks. So they want to make sure, this is still segregation of duties language. Require bank statements to be reconciled in a timely manner. So your policy should say, we reconcile our bank statement within, and this is further reinforced by the last bullet point, you have to define timely. It's my goal to do it by 30 days or 15 days or 20 days, right? Always remember, when any organization is looking at your policies, any government organization or your auditor, your policy needs to be minimally compliant with the regulation. Don't put into your policy that I'm going to reconcile my bank account by the 3rd day of every month, because if you don't, HRSA is not saying you have to do it by 3 days. It's saying define something reasonably timely, because if they come in and you had 3 days and it actually took you 17 days, they'll actually give you a finding for not following your overly restrictive policy. So keep that in mind as you're drafting policies related to federal awards. Next slide. All right. Adequate segregation of duties is not possible due to limited staffing. You have to document key controls in place. It's very common for health centers and especially lookalike organizations to be an accounting or finance department of one, right? You really might have to get creative in controls, but they should be documented. If you have any questions about internal controls, if you're receiving, and I know you're receiving a financial statement on, or you wouldn't have been able to apply to HRSA as a lookalike, you should be able to engage your auditor in a discussion and say, hey, can you walk us through your assessment of our segregations of duties, and can you help me to understand how I can improve my segregations of duties? And they would be happy to engage you in that discussion. Quick reminder that when we're thinking through segregation of duties, you want to separate 3 types of activities within any finance cycle. Access to an asset, right? This example says access to cash, from recording, from monitoring, right? Anyone who touches money shouldn't record journal entries or perform bank reconciliations, right? You can apply this to the accounts payable or any other process, but this is the process, this is the analysis that your financial statement auditor is going through that they'd be happy to talk through with you. Next slide. All right, disbursements and procurement. If I'm going to spend the most time during this discussion on disbursements and procurement, because when you are spending federal money, anything above $1, you're either buying salary and wage expense or you are procuring. And there are different processes that you have to go through. So when you're looking at disbursements from a federal perspective, your policies and procedures must require that you have to say, my policy is that we're going to maintain support for all of our disbursements, and you have to have supporting procedures. Disbursements must be pre-approved and indicate by whom. Expenditures must be reasonable, and you have to define how they're reasonable. Related to procurement, when you're procuring with federal funds, the Uniform Grants Guidance says you should have a procurement policy and supporting procurement procedures. Next slide. All right, so your policies and procedures must also require that you safeguard blank check stock. You have segregation of duties, again, over the creation of vendor accounts and EFT transfers. Why does that matter, right? People who create vendors, it's all about access to versus the recording or the actual, if you create vendors, that's access. And if you have access to perform electronic funds transfers, what can you do? You can set yourself up and pay yourself. And so this is just another way to safeguard grant funds. All right. So you have to have your policies and procedures have to talk about the dollar threshold for determining signatures on checks, and designated organizational officials authorized to sign checks. Down below is just another example of segregations of duties common to this procurement process. Next slide. Why do auditors care about procurement? Ultimately, the government wants to make sure that you're procuring in economical, practical, and competitive manners, that you're going through the appropriate decision-making process and you're not giving related parties preferential treatment. They also want to reinforce that you need documentation, certain documentation for all procurement transactions, and they want to make sure you're consistently procuring when federal funds are involved. Next slide. If you remember anything about procurement, here's what I want you to remember. When you're procuring with federal funds, there are actually 5 approved methods of procurement. They are actually defined as micro purchases, small purchases, and then sealed bids, competitive proposals, and sole source. You should have a procurement policy in place that says, I can procure in 5 different ways, and I want you to define those methods. When you're procuring via a micro purchase, this is when you're spending up to $10,000 of federal grant funding, and this is when you do very little work. Small purchases are procurements between 10,000 and 250, and this is when you have to get at least 2 quotes or bid. And then above $250,000, you have to procure via a sealed bid, a competitive proposal, or a sole source proposal. So if I want to look at your policy and determine if it's compliant, the first thing I'm going to do is look for your definitions of these 5 methods of procurement. Next slide. I mentioned those other thresholds, the 10,000 and the 250,000 on the previous slide. That doesn't preclude you from establishing other different types of approval thresholds based off of, different positions at your organization. So I just want to give you that as an example. Next slide. The next couple of slides are actually just an example of a checklist that you could potentially have in place to document the decision-making criteria that you went through when you were procuring with federal funds. I'm not going to talk about them extensively. I just provided them for reference. Next slide. Next slide. All right, we're going to go to our second polling question. This one's a true false. Organizations that only receive one federal grant don't have to have a comprehensive grants management program in place. True, false, or unsure? I think we've talked about this one, so we're going to see how well you were paying attention during the first part of our discussion. All right, so we've received the answers, and a few of you answered true, and it's not. Ultimately, organizations, anybody receiving federal grant funding has to have the whole thing in place. I always tell people there's no easy button related to grants management. If you get $10,000 or $2 million, the grants management program that you have in place should be the same. So make sure that everything that we talk about today, I do truly hope you take this back to your health center and challenge your policies and your grants management program that you have in place. Next slide. All right, matching or cost sharing. This grant didn't have matching or cost sharing, but you should have this language in a policy just in case. You would actually receive feedback during one of the HRSA desk reviews if you didn't, just because you get federal grant funding. Next slide. 7, consultants and contractors. So we've already talked about procurement. I actually think the procurement and consultant and contractor policies could be combined. And what does HRSA think is important when they think about consultants and contractors? They want to make sure that your policy defines the types of services that you may outsource, and that it requires you to evaluate your in-house capabilities before looking externally. It wants you to describe the selection process. Next slide. There's some additional language on this slide. What I think is most important is that HRSA is concerned that the fees for your contracting is reasonable, and that as part of your policy and supporting procedures, that you define how you're going to manage whomever you're paying to do something. This is very common with like outsourced billing companies. Because you outsource your billing doesn't necessarily mean that you don't have to manage the outsourced billing company. You still have to have supporting procedures in place on how you're monitoring. One of the things to remember is that anybody you're writing a check to, whether it's for salary and wage expense or whether you're procuring through accounts payable, you have to make sure that those vendors and your employees haven't been excluded from doing business with the federal government. I talked to one organization one time that received a fine because they were paying an employee that had, and they were billing Medicare and they shouldn't have. This person was, had been banned from doing business with the federal government. that organization received a $250,000 fine for every instance of non-compliance. So very frequently, I get asked how frequently should we check the excluded parties list system. I would say as a best practice, every single time you write a check. Maybe that's not practical. What's probably practical is more like quarterly, but you should be doing it with some frequency. Next slide. All right, expenditure analysis. One of the things that you should be doing is taking that grant budget that you prepared when you submitted to ask for the ECT funding, and you should be comparing it to your actual expenditures. Next slide. I have an example of what this would look like, which would be your total award, right? So you received a certain amount of grant funding. One of the things that you should be doing is adjusting the budget based off of different things that you know about that have, gotten it to change. And then if you look to the right of this image, it has different pay periods, and you should be making sure, or just different periods, you should be making sure that you are tracking the grant funds so that you know if you need to rebudget, or potentially because you're nearing the end of your grant year, you need to know if you're going to have grant funds available, and that, if you need to request a no cost extension. One of the things, Ted, that I can actually do, I know one of our questions was related, one of the pre-survey questions was related to no cost extension in that process. I could probably talk about the process for 10 minutes, but I have drafted a summary of the process, and I'll send that to you, Ted. So maybe we can make that a part of our information that we distribute to the attendees. Next slide. Indirect expenses. Even if you don't have a negotiated rate, you should still potentially have a policy, right? When you look at that HRSA webinar in July related to this funding, they pretty much said you can't charge indirect expenses unless you're using a federally negotiated indirect cost rate. If you had one, you would know, because this is something you have to negotiate with the Department of Health and Human Services Cost Allocation Services. If you elected to use something called a de minimis rate, which allows you to charge 10% above and beyond your actual expenses for the ECT funding to this grant, that was completely okay. But always remember, if you have any other federal awards, you have to be consistent in the application of your use of the de minimis indirect cost rate. And you can't just use it for ECT funding and not use it for other funding. So please be consistent in your allocation of direct versus indirect expenses to all of your federal awards. Next slide. Credit cards. Biggest risk with employees potentially diverting any type of health center money, whether it's a grant fund or other, relates to credit cards, because credit cards allow your employees to circumvent the typical controls in place, right, related to the procurement cycle. HRSA is very much going to focus on your credit card policies and how you control them. So you need to describe that control extensively within your policy. All right. You should, to the best of your ability, try to make sure that all expenditures are still pre-approved when your employees are using their credit cards. Credit cards should prohibit personal expenditures, and you have to make sure that you're getting receipts for your employees. Biggest risk with credit cards is that the people who have them are usually your C-suite, right, and above, maybe sometimes purchasing. And your C-suite is most easily able to circumvent controls, and you have to have a control in place to make sure that even if the CEO isn't giving you the credit card receipt, that there's some type of notification of the board of directors or something to make sure that all receipts not turned in with your credit card get submitted right to the chair of the finance committee or something. You have to have controls in place so that even your C-suite executives can't circumvent the controls. Next slide. All right, timekeeping. This is where 40 of the 100 grantees that had Ames grant funds audited had problems. I think it was more like 35%. There were 40% with problems, but 35, it all related to time and effort. Because when you're allocating salary and wage expense to federal awards, what do you have to keep in mind? Charges to federal awards for salaries must be supported by a system of internal controls, which provides assurance that the charges are allowable and accurate, allowable, and properly allocated, have to reasonably reflect the total activity of the employee and not exceed 100% of their time. Next slide. What's most important to remember, and this is where people get into problems, it relates to this second bullet point, budget estimates. Budget estimates alone do not qualify as support for charges to federal awards. They can be used for an interim accounting purpose, but not as your final support. If you budgeted for one of your employees to spend 0.4 of their time on your ECT grant funding, and you're allocating 0.4 to this funding, I would probably just go ahead and assume you might have a problem, right? Because I would expect that 40% is an estimate, and it's probably 55 one week and 42 one week and 62 one week, right? Budget estimates are not appropriate support for grant records. Next slide. All right, so your policies and procedures must discuss your timekeeping controls and describe how you actually track actual hours against the different federal awards. Next slide. So your employees have to certify that they're accurate. And this is just reinforcing again, you can't charge budgets. And so let's go to the next slide. When you do keep personnel records, always remember they should be after the fact, based off of actual hours, not budgeted, have to be signed by the employee, prepared at least monthly. Next slide. This is an example of a time card. I would expect if you are appropriately documenting the use of your ECT funds, that you have a time card like this, and one of the columns says ECT grant, and then there's another column that says other activities, right? And that the total is the total hours paid to that employee, and that you're tracking hours against your ECT funding. So, all right, next slide. We'll go to our next polling question. So our third polling question is, and this is my third, what are the appropriate methods for tracking and allocating salary and wage expenses to federal awards? So we have 5 options. The first option is allocate based on the budget. The second option is allocate based on personnel activity reports. Option 3, other methods based on a system of controls. Number 4, all of the above. Or number 5, options 2 and 3. One of the I didn't focus on this on one of the slides, but you can use time and effort, but you could potentially use, this is not a trick question, but I didn't directly address it. Time and effort is always acceptable, but you could potentially use like a report out of your practice management system or something that could potentially be another system of controls in place. So I want to mention that because I didn't. Time and effort is preferred, but there can be other systems. Kind of giving you a hint on this question. So we'll see how you do. All right, so the right answer was options 2 and 3. It was the 5th option. And so time and effort or system of controls. Next slide. All right, related to travel, you have to describe the following related to travel. Programmatic requirements for travel, common sense stuff. You have to have mileage at the IRS rates. Your travel has to be reasonable. Next slide. This is the language. It's very important that none of your travel expenses are exorbitant, right? That's where people get into problems. First class travel Lamborghinis, right? Your policies and procedures should prohibit that. Next slide. Related to property control, what's the important thing to remember? If you are purchasing different things, assets that you have to capitalize, you have to do an inventory of those assets at least every 2 years. And your fixed asset records have to show and support that those assets were federally funded. So keep that in the back of your mind because it should be listed in the fixed asset register. This It's a physical inventory, descriptions in your fixed assets. Next slide. All right, conflict of interest. You have to have a conflict of interest policy. HRSA has a fantastic conflict of interest policy that Ted's going to provide as part of the in the package that's related to this training. So we'll move on from this one. 15. Oh, so these are just other language in that conflict of interest. Next slide. Mandatory disclosures. We've provided a document, but you should have a policy that says if there is any fraud related to my federal award, I will report it. I would generally expand upon that to say if you have any fraud related to anything, even if it didn't affect your federal award, I would still call your grants management officer and your project officer, and I would help them to understand to be on the safe side. That first notice of award that you received had other language in it related to equal employment opportunities, civil rights, human trafficking, etc. You also need to have policies that says, I recognize that this is something that's applicable to me, and here is how I make sure that I am compliant. Next slide. Limitations on use of HRSA funds. So NAC worked with their attorneys, Feltzman Tucker, to develop a great policy in this regard that Ted will provide to all of the attendees of this training. But outside of, there are certain expenses you can charge to federal awards and certain expenses you can't. This policy goes specifically into some legislative mandates that, are, in essence, expenses that it is illegal to charge to a federal grant. Next slide. Allowability of costs. So you have to have a slide that says, when I charge an expense to a grant, it'll be reasonable. I won't spend $900 on a toilet, right? Or $900 on a hammer. It'll be allocable because I did something or I incurred an expense that was an appropriate use of the grant funding that I was using. There's always this prudent person, circumstance where what would a reasonable, prudent person do? And so a cost is allocable to a federal award if it benefits the program, so you have to have this policy in place. All right, this slide addresses program income. Even if you didn't have to use program income before you use this grant fund, you still have to have a policy in place that says, I will use all of my program income for a purpose that's approved within the program. Next slide. And then just always remember that your health center policy needs to be minimally compliant with the regulation, and you should follow your own policies. And with that, I'll turn it over to the TED or the folks at the Wright Center who will be supporting the rest of this conversation, our presentation today.
Thanks so much, Catherine. And you got through a lot of content in really efficient amount of time. So thank you. And just wanted to reiterate that we will be setting up the templates that she referenced. And then I think you referenced one or two other documents. We'll make sure that goes out to everyone who registered for today's webinar. And somewhere in there is a joke about a $900 hammer or $900 toilet in reasonable cost. Without further ado, I'm going to turn things over to the Wright Center. I want to thank them again for their engagement with NAC and with their lookalike colleagues over the past couple months. And we're going to start with Tiffany Yaskulski. I hope I got your name right.
Thank you. You did, Ted. Excellent job. Yes, thank you, everybody. So I'm here with my colleagues today, Megan Ruddy and Tom Glasser, and we're going to kind of go through what we not only chose to use our ECT funding on, but also just our grants management infrastructure in general. The first slide here is most important to us, our mission, our vision, and our core values. Our mission, obviously, I'll go through to improve healthcare and welfare in our community through inclusive and responsive health services and the sustainable renewal of an inspired, competent workforce that is privileged to serve. Our values, I will say, you'll see reiterated throughout the presentation, but our values are very near and dear to us. We take them to the highest priority from the level of our board to our patients, to our employees, and to our community partners that we decide to partner with for our grants funding. So our values are as listed here on the slide: to do the right thing, be privileged to serve, be an exceptional team player, strive for excellence, be driven for great results, and spread positivity. And these are the things that comes from our executive level right down to the patients, right out the door to our community partners. And we do our best to make sure that we are exemplar practices when we're bringing these into context here. And I'll just share a 10-year vision. We like audacious goals at the Wright Center. And so our 10-year vision is to be recognized by the President of the United States as the Health and Human Resource Services gold standard community-based model for primary health care with integrated workforce development by June 30th of 2027. And we know that we're going to get there. Next slide. So it all starts with our governance. Our governance is the heart of our vision, right? You need a good, strong governance. You need their guidance and their leadership because we can't be experts in everything when we get grant funding, when we're making these decisions of where are we going to go next. The strategic planning, can't involve just one person. It's going to take a village really to not only have the vision and support the vision, but to give us the guidance that we need to make sure that we're doing it correct, the right way. That we're being smart. So through the years, we've had thoughtful engagement and outreach. We've gone through quite an array of different members, and we're very proud of where our board sits today and who we have on our board from our community and their background. And it branches out to many different committees that we could probably spend another conversation on. So this is just a highlight of our board members, and I will just say that they are excellent, they're awesome, and when we get ECT funding, they are very engaged. Any grant funding, they're engaged, and we try to keep them involved in anything to make sure that what we're doing is community needs responsive, and that what we're trying to deliver is within the mission and the vision of the Wright Center. Next slide. Setting the course to gain traction. So obviously as FQHCs and lookalikes, I didn't say earlier in the presentation, but we have been a lookalike for about 1.5 years now, coming up on 2 years. So we have been in the space of HRSA for some time now through grant funding, but as a lookalike, we were new to the space. However, we did have a very robust grants infrastructure just from past history and from past projects that we've been involved with. But obviously, to everybody on this call, FQHCs and lookalikes are community and patient needs responsive. That's just in our DNA. That's why we're here, and that's why we come to work every day. Through the dissemination of SEDH challenges, social economic determinants of health challenges, in our area here in Pennsylvania, transportation is a big one. It was a big one before COVID, and it remains to be a big one post-COVID, or in the middle of COVID, I should say. But again, it deters patients from being able to come to their appointments and maybe put them in a position where they have to decide, what services are they going to go for today? Are they going to go to their doctor's appointment, or are they going to go to the grocery store because it's a limited resource? Motivated by our strong governance and driven by our visionary leadership, we pursue innovative opportunities to bring primary care and COVID responsive services to patients. The mobile unit here that you see the sketches and the wrap, this is what we chose to use our ECT funding on. Early in the release, again, we kind of came together. We said, what does the community need? What are we looking for when it comes to testing? We were doing testing in all of our clinics. We had even done construction in some of our sites to be able to accommodate separate entrances for patients to come in safely to do testing that removes them from the general population of who was coming in for a well visit. So we had gone through great extents in our clinics, and we didn't think that there was really any more that we needed. So the idea of a mobile unit was kind of popped into the idea of our physician leadership, and we brought it back to our governance, who took it back to the committees, and we formulated Driving Better Health is what we had tagged the mobile unit, and we're very proud of it. Immediately after we received the mobile unit, we immediately put it onto our HRSA site. So it is actually an approved clinic site in our EHB. So it functions, it represents the Wright Center, no matter where it's going. And we were very strategic before the van even came as far as what are we going to use the van for, right? The executive leadership had to come to the table and say, there's community partners out there who need this, but how do you prioritize? Who do you go to first? You have to get the contracts together, you have to get the agreements together. So we actually had the mobile unit probably booked out for patient care about 2 months before it even arrived. And we had the contracts together, and we had identified where the hotspots were in our community and where the mobile unit was going to get deployed first for the testing purposes. again, foresight, and having the fortitude to look forward beyond COVID, the mobile unit also supports dental operatories. So we figured, COVID is here now. The ECT funding is, we need it for a year to draw down the funding. But after that, when you don't have testing, what are you going to use the mobile unit for? So dental just seemed like the most obvious. We do dental pop-up clinics already in the school districts. And we do vaccine catch-up clinics in the school districts. So we just thought, in years to come, the van isn't going to go away. It is an asset now to the Wright Center. And basically just having the strategic conversations and strategic planning to go out, to a 3-year plan of what is the mode and the method that we're going to use for this mobile unit. So the next slide is a polling question. So have you recently created a logic model for grant funded projects? Yes, no, or unsure? And this will dovetail very nicely into my colleague's presentation, Megan, who's going to go in further depth into our project management and grants management infrastructure.
Yes, thank you, Tiffany. So I'm not sure if we advance the slide if the question stays up or not. We don't necessarily have to, but as Tiffany mentioned, before we were an FQHC lookalike, we were a medical group that functioned largely as a clinical learning environment for our residency programming. As we are really 2 organizations, and becoming a lookalike, we enforced the need to really divest those organizations from one another's governance. And so we now have the Wright Center for Graduate Medical Education, as well as the Wright Center for Community Health. And as the Wright Center for Graduate Medical Education, we had already been receiving HRSA funds through the Teaching Health Center GME funding mechanism. But we have also the medical group, as it was becoming an FQHC lookalike, I was working with the state of Pennsylvania in becoming a center of excellence for opioid care. We had submitted a SAMHSA grant before becoming an FQHC lookalike that actually got funded just after we found out. So we have been very heavily invested in building our grants infrastructure. And one of the things we had learned from doing that was the value of a logic model. So I see some folks, 12 answered yes, 18 answered no. Many of you left it unanswered, and that's perfectly fine. So the logic models are helpful. Some people see them as being a bit of a tedious documentarian sort of a task, but really what they do, especially when they are done iteratively with input from the board and from your executive team, and most importantly from the frontline folks who are going to be doing the work, really helps to set the stage for not only matching the vision to the reality, but also really understanding how to be truly community needs responsive. So this is the goal. This is the logic model actually for our mobile unit, for driving better health, for drawing down the ECT funds. And so it's important to understand the context of why you're doing something like this. And I'm really, really thankful to Catherine and others like her who have that detailed expertise in compliance. And in order to be truly compliant, it is incredibly important to know upfront, what are you actually going to do with the money? What is the project? And so in order to really understand the project, you have to understand the context in which you're working. And that context cannot come just from the C-suite, and it cannot come just from the board. It really needs to have a fully throated understanding of the entirety of the situation on the ground. So what are you addressing? What's happening? Of course, with ECT, the context was COVID, but there were still a lot of other things happening. There were telehealth visits. There were school children who were not getting vaccinated because their parents didn't want to bring them into clinics for fear of the COVID virus. And so all of that stuff was considered as part of our context for planning what we were going to do with that. And additionally, when you think about inputs, what are the resources that are already happening in your organization, or resources potentially that could be brought to bear on a new project? So the Wright Center was lucky enough to be tapped by the state at the time to take part in basically a COVID command center sort of a structure, where our faculty and residents were reaching out to skilled nursing and long-term care facilities across a specific region of the state. There were 6 or 7 groups that were tagged to do this, and we each had a region. And so we were building these relationships with these SNFs and LTCs we were reaching out to. And we thought, oh, wouldn't it be great if they wanted to, if they found it would be helpful, if we could send a mobile unit out there. We knew we had the funding available. We knew that there were the tests. So we were doing this, gosh, what was this? Summer of last year, we were doing all of the planning. And so we knew the tests were coming, and we had great faith that the vaccines would shortly be coming. And we thought, okay, so yes, it's testing, but you know, what happens to our ability to provide testing and vaccines? And so can we force multiply the value of something like a van? Having to think about the staffing, you know, how do we staff this? We've got staff that really knew, they were really understanding the process of the testing and the different kinds of testings, and the process for sending things out versus doing things on site. And everybody was learning so much. And we had a ton of regional partners involved, including the Area Agency on Aging, school districts. We were lucky enough to get some additional funding from the CDC Foundation grant for vaccines. We were fully engaged with our rural county commissioners, both in counties that are in our catchment and in neighboring counties that might be slightly outside of our catchment, but still that we want to partner with, because we are really interregional collaboration. Is a co-creative space where there's so much more that's possible rather than looking at it from a purely competitive perspective. And then outputs. Now, this is something that I have to remind myself all the time when I make logic models, and I do them quite a bit. My brain wants to connect outputs with outcomes, but they're really not the same. So the outputs are the activities that result in the outcomes. And so what are the actual things that your project is going to allow you to do? So for us, it was, you know, COVID testing and care, vaccination events, community health fairs, intentional outreach to community members without functional housing, dental events, public health education, and cross-organizational engagements. We really want to use our mobility in this space, pun intended, to be able to help other organizations treat the community. Our whole thing is, we don't really care who's doing it as long as it's getting done. And if we see that it's not getting done, we're happy to step in and help. And so all of that is important to set the context for the goals. For some folks, it might be easier to jump to the 3, 12, 24-month goals, especially as you're writing a grant. You can sort of think of this as your work plan and your outcomes and your objectives. You can put that into the 3 and 6 to 12 and 18, 24-month part of a logic model like this. But it helps to have that context so that you can help to refine your goals over time. And at the bottom, you can see assumptions and drivers and external factors. And this is just a great sort of one-pager version of the beginning of a project management process for a funded project. Next slide. So this is one of the key documents that we have developed internal to the Wright Center. It's not necessarily unique to us, the way that looks might be, but the pieces are pretty standard in the space of strategic execution planning. So for us, it's 2 slides, but I didn't want to make it too messy, so I just took a picture of the first one. The bigger pieces are on here, and you might look at this and say, wasn't there a lot of crossover with the logic model? And yes, there is, on purpose. One of the reasons why it's important to document it in several places is for the coherency and cogency of the project. Because if you work on one document and you see something on there that's not on the other, it's supposed to give you pause and think, okay, why was this missing? Is there really a relationship? Is something in one place but not another because maybe it's not that important? So it really just helps to align all of the documentation. But in a document like this is where you get to really think about the business problem, because ultimately with a grant funded project, it is all too easy for nonprofits to get stuck on the treadmill of grants and aid. But especially in a lookalike, because we can't rely on the H80 funding, we need to make sure that our projects are sustainable post-funding period. And so we really need to think about a sponsored program, what we would call sponsored programs, a funded program, a funded project, a grant project, as being the solution to a business problem. And therefore, there needs to be a business model, and there needs to be a business opportunity that is addressed by this grant fund, by this grant project. A value proposition that is beneficial for the org as well as for the community and the medically underserved area of your catchment and your partner ecosystem, and then really thinking through an operational project plan that should have all of these different pieces. Next slide. Excuse me. So this is what pieces of an operational project plan will look like. And I was given the opportunity just now to accept the ball so I can share my screen, but I want to describe what I'm going to be sharing first. So essentially, we've learned over time that there is a phased approach to large projects that helps to ensure everyone is on the same page and it really helps to ensure that there is a real business case model being applied to a funded project so that there is sustainability long term. So over here on the left, you'll see the phase 1, 2, 3. Those are the ways that it works for the Rice Center. Those phases in that order may not work for every organization, but we wanted to share that as a potential framework for how to think about putting together a stepwise progression in the creation of a project that would be able to utilize ECT funds or any sort of funds. So you'll see on here I have a little snapshot of our marketing matrix, the Driving Better Health Mobile Unit COVID testing routine back communication matrix. So we have our marketing and communications folks working on it so that they understand that this is coming and they have a plan to help it get up and off the ground and keep it sustainable. You'll see a little snip of a spreadsheet. Those are the financial projections. They go 3 years out. And so, the grant funding for ECT was 1 year, one and done. But, purchasing a unit, and like Tiffany said, creating a new site required that it have a long-term sustainability and a staffing plan. So I'm going to briefly share my screen and show you one way to manage something like this. And it is a project management software called Smartsheet, and we're not sponsored by them or anything, we pay for this. But I just wanted to show you an example of one way to get this done. You'll notice that it's essentially a fancy, very integrated spreadsheet. But the thing that's wonderful about it is that you can upload your documents in your stepwise fashion and then lock the lines so that no one can remove the documents. You can click on here and see all of the documents in place. And because I'm sharing my screen, I don't want to get too fancy with my display because I don't want to necessarily lose everyone. The other thing I wanted to show folks is that, so if you are a department of one, you end up having to do a lot of chasing. It's exhausting. And the people on the front lines, especially right now, are doing so much work. Sort of how do we keep all of this in track? One of the great things about a software like this, or Basecamp, or even an Excel with macros, if you know how to do that, is the automated piece so that you can assign people to certain rows, you can set reminders. One of the things that we really like about Smartsheet is that you can actually create a form that is based on all of the rows that you have, and you can send this out and people will just get an email with the information that you need them to upload, and then they hit send and it goes right back into the Smartsheet. So I just wanted to demo that very, very briefly to let folks know that there is a lot of option out there in terms of how to manage these things so that you don't necessarily feel like you must, sort of do it all on your own. And we're more than happy to talk to folks about this. If you'd like, I know that we're kind of up against time and I'd like to hand the rest of the presentation over to my colleague, Tom. Thanks, everyone.
Confident in your, sorry. Is that better? Are you confident in your organization's ability to appropriately handle the tasks of the pre-award process? The answers are yes, no, and unsure. Now, as a reminder to everyone, the pre-award process is the point from when we sort of register with all the government agencies, grants.gov, SAM, System for Award Management, et cetera, the point where we come up with the idea and actually find a notice of funding opportunity, sort of frame what we're going to do, put it together, and upload it. That's sort of the whole pre-award process. So we'll just wait for a moment to see what the answers are. So we have yes. So most people are yes. That's very good, and some unsure. So let's go into the process with the next slide, please. So, our first task at hand is actually making sure that we have all our current registrations in place with the government. And everyone here, I believe, has already gotten a grant. So we've already done all this. The only important things to remember is the system for award management is a key registration. It must be renewed every year. It takes time to renew it, and it's important to do that in advance. The other thing is to select authorized organizational representatives who sort of are individuals who can sign off for the entire organization on behalf of grants. The next steps are the ideation, where we actually come up with the idea. Either sometimes, often our CEO will come to us and say, oh, I saw a funding opportunity, or I have an idea, and we have to go out and find a grant to fit it. And in the prior case, we get a notice of funding opportunity, say from HRSA. They're about 30 pages, 40 pages, 50, it depends. The most important thing is to read it. Read every single page. Take one of those red sticky things and go throughout every page on all the important parts. What you'll find is if we don't pay careful attention to every portion of that NOFO, we risk being excluded from the opportunity. So here we actually have two individuals go through them, and then we sit down and share. And a good example is we had a CDC opportunity a couple of months ago that was like a puzzle. There was a portion with, these are the requirements on this page. When we went through all, I think it was 45 pages, there were things scattered everywhere that were absolutely required. Now, had we not read that carefully, we would have missed out on that. So look at it sort of like a puzzle. The other things that we look for are upfront. We have a vetting process, which is, it's a new process that we have here. We have 13 factors, and we score these factors either as a negative, -1, neutral 0, or positive 1. Some of the factors are, does it fit with the organizational priorities? Does someone here have expertise in the grant-related subject matter? Are we ready to do a resource commitment that's required here, and et cetera? There's 13 areas, and we require a score of 3 or better to actually have a look at this opportunity or consider it. Once we have that done, the opportunity goes for the board, executive approval, and most importantly, the stakeholder approval. We're a clinic here, as everyone else is, and the work is going to happen in the clinic, and we should never submit a grant without the input of the clinical staff, the chief medical officer, the chief operating officer, and the data people. Very important pieces to make sure that if we do get this grant, we're not going to be scrambling around, unable to sort of meet the requirements or the data needs. The next thing, framing refinement. Our MO here is sustainability. We don't even consider putting a grant in unless we can show it's sustainable. We create a plan, we craft a plan in advance. We don't do grants that are one-offs. We don't do grants that are going to bring staff on only to be sort of terminated after the grant is over. Any grant brought in here is going to serve the community in an ongoing way and be sustainable. So again, that's how we operate here. For the framing and requirement, we do a proposal timeline. So we sit in a room with the expertise, with the faculty member, with the grant staff, with the data people, and we sort of work out a plan on who's going to do what and what are the timelines so we can get this thing together. Some of the important pieces are the budget justification. I've been in this area for a long time, and the budget justification is a very important piece of a grant proposal. Often the sponsors will take and read your narrative or your science, which is vital, it's key. They're also going to take a look at the budget, and they're often going to give the budget and the budget justification to their audit staff. And they're going to look at it, and they've seen these a million times before. They're going to be able to see a well-done budget, a well thought out budget narrative, and a well thought out project. And if those things are well thought out in the beginning, there's a much better chance that we're going to get an award at the full amount of our ask. There aren't going to be any cuts. There won't be any questions, etc. Other required attachments that are required in the pre-award phase are everything that Catherine mentioned. And Catherine and I are on the same page with the importance of policies, travel, business expense, procurement, accounts payable, indirect costs, cash management. All of those policies are vital and critical to have and actually to follow carefully. Our next step is implementation. So we get the award and we congratulate ourselves, of course. And then we sit down with the notice of award, read it very carefully, share it with the stakeholders, and then call a meeting of the stakeholders. We sit down with the post-award staff, project management staff, project director, the clinical staff, and the data people. And we sort of plan out how we're going to finalize the work plan, the budget, the sub-agreements, and what kind of staff do we need to hire, or do we deploy existing staff? The next part is the actual deployment of the grant. Project management is a very important part of our operation here. We have overall leadership of the project is with the project director, and the successful implementation is, I'm sorry, I forgot the poll question. Are you confident in your organization's ability to appropriately handle the task of the post-award process? The answers are yes, no, and unsure. And post-award, again, is everything after the award is, after the notice of award is received. So I think, given our time constraints, we'll just keep moving on. So the project manager, they ensure stakeholder communication. They ensure that the aims, goals, and deliverables of this project are actually met and are able to be met. The data and materials are there. The progress reports, the post-award staff work very closely with the project management staff to craft these progress reports, which are important and vital that they're submitted in a timely manner. It's an area of compliance, actually, too. We work with the project director and project management to ensure that all the expenditures are allowed, allocable, and reasonable. A very important piece here is sub-recipient monitoring. It's the complete responsibility of the prime awardee to monitor the sub-awardee. So if there are any questions about how the sub-awardee spends funds or the outcomes that the sub-awardee has, they do not go, the auditors or the sponsor does not go to the sub-awardee, they come to the prime. So we need to be prepared to answer all those questions. And to do that, we need to have a very good relationship with our subrecipients. We need to have plans in place to monitor their work. We need to have very good structured agreements in place showing what the expectations are from us to them, what they can invoice on, at what points they can invoice on, and how the invoices will be reviewed once they reach us. So there's complete clarity with our sub-awards, and that's an important requirement as well. We have a grant accounting department here that does all the drawdowns that were discussed at length by Catherine. They actually also review all the invoices that are to be paid on grants and make sure that they're shared with the project director, with post-award, so that they have complete sign-off and they are allocable to that specific grant. So we don't have a charge going onto a grant unless it's signed off by about 2 or 3 different people from different departments. They give basic financial oversight for the funds. They prepare budget to actual expense reports every month. They do the reconciliation of the grants every month. And very importantly, they're assigned to be the first stop for the auditors coming in at the end of the year when we have the single audit. So it's up to our grant accountant to keep track of everything through the year, make sure that he or she is prepared to pull those selections once the auditor comes in, and all the required backup, et cetera, that we have for those. We pay very special attention to the uniform guidance, finances, compliance, and again, like Catherine said, it's all important for when we have site visits, because one finding is one finding too many. Closeout is the final part, and we implement. We have dissemination. We put that sustainability plan that we had in place from the beginning and worked on through the whole process in place. So the personnel who were paid on the grant continue on whatever our plan for them was. Equipment disposition, and our final progress and financial report, again, always on time. And that's the end of our post-award presentation.
Thanks, Tom. In an interest of time, I really just want to, just a quick note, when we got the mobile unit, I just wanted to point out for the executives who may be on the line, one thing we did in the middle of COVID is that we didn't bring on any additional employees in order to run the mobile unit. We used internal resources until we were able to get the mobile unit on a sustainable business model. And I'm happy to say now, about 9 months into it, we are looking to hire employees just to staff the mobile unit because it's been such a success in our area. But again, looking at your internal resources before going out and just quickly spending your funds, making sure that you're doing it judiciously, and that there's a true need before you cut the expenses. So next slide. And then the last was just the model for post-grant funding sustainability. And again, this was just the ribbon cutting ceremony actually for our mobile unit. But just a great example of how to envision, plan, spend down funding, implement, and achieve financial independence. So thank you, everybody.
Awesome. Thanks so much, Megan, Tom, and Tiffany for an awesome presentation. And just want to remind folks, we do have some questions that come in through the Q&A. And Catherine, I thank you for responding to them because we are running out low on time. Before let's see if you have anything else to add, though. One question did come up for the Rice Center around smart sheets. And can you use that for timekeeping and tracking? I'm wondering what your practice has been, what you use.
Sure. So we don't use it for that, although one could. So if you wanted to have employees, if you wanted to set up that form, if you wanted to set up a project that would just be a sheet that would have sort of like the time tracking sheet, you could set up one of those forms and automate it to go out to employees at the end of every day or at the beginning of the next, if you wanted to time track that way, or you could set it up kind of on any schedule. So you could do that, but there are other ways to sort of do that on the back end to kick that out of the employee's hands. So it just sort of depends on how your organization wants to set something like that up.
Awesome. Thanks. And also, I just want to, again, comment on the logic model. As someone who's done logic models in the past, it's really great to see one that's been implemented and that you're using and use more. So I'd love to see more examples. And we share those with our Learning Collaborative. So thank you. Catherine, in the final moments, is there anything you'd like to say at a high level in response to some of the questions? Anything you want to elaborate on?
Well, so one of the important questions related to the timekeeping, and there was a question about if our timekeeping is approved electronically and not by paper time cards, is that acceptable? Absolutely. Anything you can do to automate any type of approval process that's in place at your health center, nobody's going to have a problem with that. Remember that what's important is that there's an appropriate certification, and so that your employee, when they certify, they're certifying that their time card is accurate and that they've tracked it against the award. You need to have that right disclaimer language. So that's what is important. I would actually say that paper is discouraged, right? But remember, it's important for the employee and their supervisor to do that approval. So keep that. I think that's important. I actually was listening to a presentation from an OIG auditor the other day, and they said if the employee certified their time, they would ask minimal questions because that's the absolute best control in place related to salary and wage expense.
Thanks, Catherine. And I see that you also answered a question around, oh, was there another comment?
Nope, I was actually just going to say, since I didn't see another question, that at BKD we also use Smartsheet. It's an amazing project management tool. And if you haven't looked into the capabilities, I know you can download a license for like 30 days, and you could really get organized and do some tracking with Smartsheet. So it's very useful for grant funding, but many other projects and aspects of your operation. So I love to
not
see the right centers using it.
Yeah, and NAC also uses it for our cooperative agreement and HRSA reporting as well. So we're not turning this into a Smartsheet promo.
It is very helpful.
So with that, we are at time, and I want to be respectful of everyone's time. So again, I want to thank our amazing panel speakers today, and then everyone who stayed on to be a part of today's webinar. We will follow up, as I said, immediately after this with an evaluation link. So please do fill that out. Within 2 weeks, we'll have the recording, and then we'll have all the materials mentioned, and the ones that we've discussed will add to the resource package that you'll get. And then also you'll be on our mailing list now. So as more things come available, whether it's policy announcements regarding funding or other training and technical assistance opportunities, you'll receive those. So again, thank you for making the time today, and have a great day.